This year's WHO Conference of the Parties, COP11, in Geneva, marks a turning point in global nicotine policy. Decisions made here will determine whether the world continues to support tobacco harm reduction or turns its back on one of public health's greatest opportunities. For 1.3 billion smokers, these choices are not theoretical. They could decide whether safe, smoke-free alternatives, like nicotine pouches, remain available, or whether prohibition drives people back to cigarettes. The evidence is clear. Sweden is now the first country in the world to reach smoke-free status. Fewer than 5% of adults still smoke. And that success didn't come from bans or prohibition. It came from providing adult smokers with lower risk alternatives, including snus and nicotine pouches. A similar story is emerging in Saudi Arabia, where responsible regulation of nicotine pouches has already helped thousands quit smoking. When properly regulated, these products can save lives. Yet, as COP11 approaches, a leaked European Commission position suggests a push to restrict or even ban these products. The justification: youth access, marketing excesses, and uncertainty. But banning the least harmful nicotine products while allowing deadly cigarettes to remain legal defies both science and logic. Let's be clear, nicotine is addictive, but it is not what causes smoking-related disease. Combustion is. Public health policy must distinguish between risk levels, not erase them. The World Health Organization's own treaty, the Framework Convention on Tobacco Control, defines tobacco control as including harm reduction. Yet, its current stance does the opposite, ignoring real-world evidence and success stories. In contrast, the US FDA recently authorized 20 nicotine pouch products, recognizing them as appropriate for the protection of public health. That's what proportionate, science-led regulation looks like. If COP11 turns toward prohibition, the world will lose a proven harm reduction tool. If it embraces science and proportionate regulation, millions more smokers can move beyond combustion and toward a smoke-free future. At GINN, we encourage policymakers: do not close the door on innovation that saves lives. Regulate, don't prohibit, because harm reduction is not the problem, it's the solution.